Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. I'm really happy you're on this channel. Please click subscribe and hit notifications. That way you never miss an upload. And we put up shows every Monday. It hasn't been easy, but you know what? You do the best you can with what you've got, especially in this COVID season. I want to thank you for keeping us company. It's always wonderful to hear from you. So if you see something in the show and you want to speak to us about it, drop your comments in the comment section below. And joining me for yet another update in this COVID journey that we've been walking together is the Secretary General of the Kenya Medical Association, Dr. Simon Kigondu. Hey Doc, how are you?
I'm good, and you?
Mimi niko salama. Jana tumezungumza and you are very busy on the move, but thank you so much for setting aside time for me today to just touch base with you and find out how you're keeping. Mnaendeleaje?
We are doing well, and you?
Happiness, trying to stay safe and do all the right things, and especially now because it feels like life is back to normal. Flights
Yes.
are open. I think the only people who aren't going to work now are children, teachers,
Yeah.
and
Yeah.
bar owners and mixologists and such like people. But for all
Yeah.
intents and purposes, life is back to normal, is it not?
As we had alluded to earlier, the lockdowns and the limitations of movement had actually been put in place so that everyone puts their house in order. So that you establish hand washing stations, you establish that whether you have water or not, and for the health system to ensure that they are strong enough to support someone should they become unwell. So the situation was not going to last forever, and currently the challenge is on those who have not opened to see what is the reason that they have not opened. And as I had said earlier, the challenge of schools, they actually need to move with speed to see how to put conditions in place such that learning continues. And yes, we were not going to have a lockdown forever, so to speak. And therefore, we sort of, in quotes, back to normal.
Okay. Now, speaking about this new normal, every day we still hear of soaring cases, numbers of those who've tested positive. But as I was reflecting about a week ago, I thought to myself, Doc, just what do we know about these new cases? How many reinfections do we have from people who, say, for instance, tested positive, they got well, they were fine, and then they tested positive again? Do we have any track or record of reinfections in Kenya?
So that's a good question, and that question falls on the realm of those who have the data. And we as scientists have advised that for every case that we get, we need to get local data. We need to learn from any of the positives that we have gotten. We need to collect data on them, analyze how they are faring, what their progress was, and for instance, if there is any adverse outcomes like death, for instance, then my view as a scientist is that it would be important to actually establish what the correlations are. And I'm a strong believer, for instance, that actually post-mortems should be done for people who are reported to have passed away with or from COVID-19, so that this data of knowledge becomes of what data we are learning from COVID-19 in our local setting for future improvement. So yes, the people with the data need to actually analyze it. And I think a lot of the data goes to the Ministry of Health, and there are various departments charged with actually doing analysis of this data. For now, I think there's a consortium of universities, including University of Nairobi, Kenyatta University, and others who are, they keep discussing daily these cases. And there's a a team in charge of the cases. And therefore, we expect that at the end of all this, and even as we go on, we'll have collected adequate information to help guide with the treatment and what the future holds.
Okay. Speaking about treatment and what the future holds, there are two things I'd like us to address. The first is a lot of patients have checked from going to healthcare institutions. People who regularly come in for therapy or treatment or follow-up. In light of the pandemic and what we've heard about hospitals being full, there are a lot of people who are sitting at home are choosing to delay their treatments and choosing not to come in to the hospital lest they get infected with the coronavirus. What are the chances of being infected by coming into any hospital today?
At the beginning of a pandemic or the beginning of an illness that is unknown, whose effects are known, whose length of stay, so to speak, is unknown, there would be those kind of, we don't know what to do. And that's where the health workers come in. And with time, actually, we are lucky as Kenya that we got the pandemic several months after the China, for instance, Europe and America. And therefore, there were already lessons on what we needed to do this. So we sort of had a knowledge of the illness before. So these fear of hospitals may be actually less in Kenya than in other places. So we now have enough data to know that COVID-19 is spread through the air or aerosol. And we have seen that part of preventive measures may include wearing masks. We also know that the relationship with surfaces, meaning that the aerosols may drop on surfaces and it is your hands that brings to the nose and all. And therefore, with this knowledge of disease transmission, we are able to come up with ways of seeing how to try to reduce the spread of it. Hospitals have also set up measures where you go in and you can get tested. So yes, the fear of people saying that they would go to hospital is there. And of course, there is no need of going to hospital if you do not need to go to hospital. That's why even visitings of hospitals have been limited to the really necessary. That's one of the ways of presenting. As usual, the African way is to visit hospitals. The whole clan, Wu-Tang clan, has gone to the hospital, but now that has been limited to what is essential. That's another way of preventing transmission within the hospital. But now there is also information that should you be getting some of these symptoms and you think that, oh, maybe I may, maybe not, then you are advised to have a test. And there are various places where a test can be done. And now in the era, now that we had reached community spread and the numbers have increased significantly, there is room for what is called home isolation and home quarantine. So because previously the procedure was if you are positive, you are kept in a special isolation area, which were essentially medical places. But with the numbers increasing, that became not possible to sustain. And therefore, there are actually people who are on home isolation. They are positive, but maybe do not have symptoms that warrant hospital admission, and they are allowed to isolate at home. The Ministry of Health has come up with guidelines on what is needed for home isolation. Like they would inform you if you have a room separate from the other family members, ability to have a mask, for instance, all those things of having hand washing and facilities basically able to allow you to stay for some time away from people you may spread it to, then come back. Because if you remember clearly, we said 80% would be asymptomatic and may not need hospitalization.
Speaking about home-based care, I'm thinking about a post that I saw, and it was people sharing it on WhatsApp, and it concerned getting vitamin D and telling people, mwende mujitandike nje, between certain hours so you can get that vitamin D. So for people who are positive, I'm just thinking, if you're in self-isolation, how are we going to go and put you outside on a balcony? Aren't you going to be exposing others as well?
There is the asymptomatic part. And the asymptomatic part, there are people who have symptoms like a cough, you would have fever, you may have some muscle pains. So basically, it is the medicines you are given are not for treatment. They are for just relieving some of the symptoms that you have. So some of the recommendations include vitamin C. Vitamin C is used in some of the processes that help to protect the body in various ways. Then you have zinc, which has been shown to be useful in the same way. And therefore, the aim is to have these measures that relieve some of the symptoms that you may get. That is for the people who are at home. If people get admitted, then the hospital takes over the care of that, and they will know what to do. If someone does not have adequate oxygenation, they're given oxygen. If someone needs intubation, they're intubated. You get, yeah. So being out in the sun is a good thing. So enjoy the sunlight, getting all those things that you have said, the supplementary oxygen, supplementary vitamins is okay. So, but you can always consult the doctor for them to tell you what you can get.
Yeah, but if they're sick and they're out on the balcony, they've got to, wear the masks and think about other people. So umeketi kwa balcony ukikoholia kila mtu. Sasa mkwaje?
But if you're in the balcony, you're likely to be in isolation. You're likely to be alone. You can actually remove your mask. You see.
Okay, so as long as you're on your own, okay.
On your own, yeah.
All right. One more issue that has come up, and a lot of people are really suffering from this, is insurance cover. Many insurance companies have said they are not going to cover COVID costs. And when we see what those costs look like, most of the money goes towards PPEs for the health workers. Some of these charges, when you see an itemized bill, for instance, I think there was one on Twitter that was floating around about someone who'd passed away. And if you look at the costs that just went solely to PPEs, not even medication or equipment, on PPEs alone, it was quite large. And I can understand why insurance companies are struggling with that. But what's the way forward for insurance companies? Because again, in them saying they're not going to cover people, I know a lot of people who said, then fine, we're not going to take out cover, we're not going to renew until such time as we feel that the health cover is actually going to benefit us. So what happens next? Where do we go? How do we begin to take care of our health as a nation if we can't even afford healthcare costs from insurance companies? What do we need to do with our own NHIF? Where do we begin?
Universal health coverage, the concept is that you are supposed to be able to get quality healthcare without sending you into financial distress. And that's the concept of insurance. Insurance means that people contribute to a pool that it is understood that that amount will be used towards healthcare provision, but it is also understood that only about 0 to 5%, let's say, of the people may require that amount. And it will be enough eventually because a lot of people are in that pool. The bigger the pool, the better, because less will be spent. But one individual person can actually cost a lot of money. For instance, if someone, for instance, gets cancer, for instance, their expenditure may be high. Now, the insurance model is also important. We have now what is the profit insurance model, whereby some companies provide insurance with the aim of getting a profit at the end of the day. And, profit is income less expenditure. So the less expenditure they would have, the better for them and for their aim of a profit. And that's why it becomes difficult for a national health program to be profit-based. It must be able to be sort of cover the society, but not aiming at making a profit. And that's why the national insurance schemes should actually be aiming at providing quality health care without making a profit, so to speak. And therefore, your insurance company may not cover for COVID because COVID they deem it to be costing them more. And therefore, a lot of insurance companies have rushed to say that they do not cover pandemics. And a pandemic is actually like any other illness. For instance, COVID would cause a pneumonia. Why should the insurance not pay for a pneumonia? But just because someone has been told it's COVID, then they look for a way out of that. So that said, then we would need to strengthen our National Hospital Insurance Fund such that it covers sort of everything. If you had a card and it's an NHIF card and you can walk into any institution and get the quality care that you deserve, then that would be the ideal. And therefore, it is for up to the citizen to agitate that their government provides a comprehensive insurance that is able to cover their health anywhere in this country. And with that in mind, then we would need to advocate for quality public health care. And that means having good hospitals and quality, well-trained human resources for health. Personally, you'd want to have a gynecologist like me all over the place, such that when you come with your card, you're able to see me and treat anywhere, you see, and that is the right for every Kenyan. So in this insurance issue, it is for the Kenyans to actually advocate that when you're paying for insurance, then you should be able to get quality healthcare anywhere in this country.
In winding up, knowing that it is business as somewhat usual now, what are you going to stress on for all of us going forward? The things that we must not stop doing, the things that we must also incorporate if we haven't been doing them yet. What are your final tips on staying safe in this season?
That is simple. Wash hands with soap and water. Sanitize where there is no soap and water. Wear a mask. Avoid unnecessary travel. But more important is that we know that COVID-19 will be here with us for a long time. So we must advocate for measures to mitigate should you require healthcare as a result of COVID-19, the illness, so to speak. So we need to ensure that our healthcare system is strengthened and that we also have access via advocacy for good insurance cover to ensure that your government is able to provide you healthcare when you need it. So we are here with COVID-19 and we just ensure that all of us play our part by both doing what we are supposed to be doing, following the instructions. And I think the guidelines from the ministry will keep coming. They keep changing, but the basics are the same. To try to avoid the illness through limitation of spread by measures that have been advocated for, and ensuring that you get quality care when you can.
Fantastic. As always, it's been great touching base with you and catching up with you, Dr. Simon. I wish you and all the medics well. The doors remain open. We will chat again, I'm sure. Until then, please stay safe, deliver those babies, and suggest to the mothers to call the girls Sheila. Sheila is such an epic name.
No, I agree. Send the link. We will send it out for you.
You are the absolute best. Thank you for catching up with us on this episode of Sheila Lives Out Loud. As always, drop a comment if you've learned something or you'd like to say what you've learned or not learned, or you know what I'm trying to tell you. Drop me a comment in the comment section below, and I look forward to catching up with you again next Monday. Until then, stay safe, stay sane, and follow the good doctor's advice. Live out loud in all that you do. Bye for now.